So a relatively young person in her 50s, which I think is still young because I'm getting a little older, but she'd been suffering from rheumatoid arthritis for 15 years. That's not good because that means she had her disease since the early 40s. And the problem with rheumatoid arthritis, unlike osteoarthritis, is that there's a lot of inflammation involved with rheumatoid. Osteoarthritis has some inflammation, but rheumatoid is a lot of inflammation. And that inflammation, if it's not checked, can destroy the joints. And in the good old days, or bad old days, when we didn't have good medicine, you'd get deformities, right? So this individual is on immunosuppressants to support, to reduce that inflammation. And in her case, even though she's on immunosuppressants like Humira, sometimes that's not enough. She's on steroids, oral steroids. That also reduces inflammation. And sometimes that's not enough. So then she gets steroid injection in the knee because that's the joint that affects her most. So what we did here is use conventional medicine, which is, for the short term, bring that inflammation down in the joint, because if you don't, the joint is getting destroyed. So there is a time and a place to use medicine, and that's now, which is, so what I did was I prepped the area, that means to clean it, make it sterile, isolated the joint line, the gap between the top and the bottom bone where the knee joint is. And in that space, I was able to put in a combination of lidocaine and steroids. The idea of the lidocaine is to get that instantaneous relief, to make sure I'm in the right spot. So if the patient says, you know, I feel better already, that means I'm in the right spot. And that's where the steroids would go into. And it takes a few days for the steroids to take place. But whilst we're on the subject of what I just did, which is the procedure, I want people to understand that if you don't ask what the root cause of that rheumatoid arthritis is, then you can never really truly treat. In my definition of treatment is to fix the problem. When you take Humira and you control it, that's not fixing it. When you take Humira and you take steroids, you're not fixing it, you're controlling it. And so what I did was just support and control in the short term, but what I was able to tell the patient is that, you know, there are side effects to those medications. Terrible side effects to taking oral steroids: thin bones, high sugar, high cholesterol, weight gain, and, you know, brittle bones, a weaker immune system, so you get susceptible to infections. And Humira, just as the ads on TV tell you, is that watch out for TB and any other infections, you know, any sign of infection, to seek medical advice. It's because, you know, rheumatoid arthritis is called an autoimmune disease. That means that her own immune system is attacking parts of her body. And in rheumatoid arthritis, it's predominantly the joints. Arth stands for joint, itis stands for inflammation. So arthritis means inflammation of the joints. So in her situation, something in her body is activating her immune system, and her immune system is going out to attack. And what Humira is designed to do is to block the patient's own immune system. Now, short-term good, because you don't want to damage and destroy the joints, but long-term your immune system is being compromised. And so the number one thing that people should be aware of, that when you have an underlying inflammatory disease, like inflammatory bowel disease, inflammation in the joints, autoimmune disease, vasculitis, those people have twice as many heart attacks, because inflammation is the prerequisite to heart attacks. And frankly, when you're on strong medications like steroids, I told you that numerous side effects. And when you're on strong immunosuppressants, those are medicines that suppress your immune system, not only are you susceptible to infections, but more than likely, you're probably going to be more susceptible to cancers, because your immune system is every day, every minute fighting parasites, bacteria, viruses, cancers, inflammation, wear and tear. And so, in short, I think that what I demonstrated is that there's the power of using medicine, but also the limitations, and to understand that whatever the condition is, if you don't ask yourself what's the root cause of the problem, you can't truly treat it.